If you have a missing tooth, it can really be something that's challenging, yes, from a psychological standpoint and from an aesthetic standpoint, but also even from a functional standpoint. And so figuring out a good way to replace that missing tooth is really important, and we want something that's going to last, that's going to be successful for the long term. There's usually three main options for replacing a missing tooth. One of them is something removable. Something that we'll call a flipper or a partial. You take it in and out at night, oftentimes it hooks to your adjacent teeth in there. A couple of options as far as things that stay in place for us in there. One is a bridge, and so that's basically, in a sense, a crown on either tooth adjacent to that missing space. And then we have kind of a fake crown that's attached to those two teeth. It all cements into place as maybe like three crowns, if you will, that cover the teeth on either side as well as that missing space. Downside to them is that we now have to damage the teeth on either side. We have to work on those teeth in order to replace that one that's missing in the middle. Oftentimes the most predictable, best solution for people is what we call a dental implant. So a dental implant is, in a sense, an artificial tooth root. So where that tooth root used to be before the tooth came out, we can replace it with a new one, just like an artificial hip or an artificial knee. And then on top of that artificial tooth root, we put a tooth. And when we have a tooth on top of that implant in there, it enables everybody to have something fixed where they can smile and chew and function like normal. They can also floss between them. You don't have the same challenges keeping things clean as you do with a bridge, for example. Success rates on implants over the long term also are the highest of any tooth replacement solution in the industry.